Okay, I've been a nurse for several years, and I had an incident which I had witnessed other people be involved in, but it never involved me. I had a patient who, over a medication, when I turned my back on her, walked out of the room, jumped off the bed, and attacked me to the point where she tore my rotator cuff. It took 6 people to get her off of me. The whole time we were in an environment in the emergency room that was very chaotic, and it made the situation even more chaotic because nobody knew how to respond. There were other patients there. Everybody was trying to protect their patients. And in the meantime, this woman was extremely vulgar, very volatile, and was determined to do a lot of harm. The long and short of it is we did get the patient, the woman who attacked me, we got her off of me, sedated her, called the police. It was very, very, very upsetting to not only myself, but to my family, to my co-workers, to pursue this. It was something I felt I had to do for the sake of me and assuring myself that I could get control back. And so I did take her to court. We had a couple of days back and forth at court where she was declared not incompetent, but she was declared crazy, and which made it more difficult for me because basically they looked at me like there was something I should have done to prevent this. Mind you, I had walked out of the room and she attacked me from behind. So there really wasn't much I could do, and I was trying to medicate her prior to this incident to keep her happy. But it wasn't fast enough, and it wasn't the med that she wanted. As nurses, we have no control over what the doctors order. We can make suggestions, but they don't always follow our guidelines. So I felt that the hospital was not supportive. My co-workers, some were not. Some felt that had I handled the after incident differently, that, because I had to take time off to go to court, and people resented that I was getting the time off and I was getting paid for it, but I only get paid for it because I fought for it. And I blamed the hospital for not providing adequate staffing for security. This would never have happened had the hospital provided security. They did not believe that there was any reason to provide security because it was just another nurse getting hurt. It's very, very, very disheartening to have somebody take away from you not only to have the element of surprise, but to take away from you your role as a caregiver is now jeopardized because you're on guard when you go into anybody anymore because you just don't know what's going to happen. And it was very upsetting for all of my other co-workers who some of them had been assaulted, didn't want to pursue it. And I think had we all pursued it from the very beginning, had we stuck together and demanded from the hospital better staffing, better security, we would have been in better shape and we could have avoided something like this from happening again.